I am Dr. Pankaj Adhicari, Professor and Head of the Department of Dermatology, Guwahati Medical College. Today, I am talking about hair loss. Definitely, nowadays, the hair loss is a problem, the burning problem, because many patients have been suffering from hair loss. The hair loss may be diffuse or it may be sometimes localized. Talking about the diffuse hair loss, which is a burning problem. So it is divided into the categorically. It is telogen effluvium or anagen effluvium. So diffuse hair loss, if you consider the causes of different types of hair loss, if you consider telogen effluvium, so main cause is some underlying diseases or some deficiency diseases. So telogen effluvium, we come across so many cases in our practice. So if you see lots of patients nowadays suffering from dandruff, which is known as seborrhea capitis. Sometimes some diseases in the skin, in the scalp, may precipitate diffuse hair loss, and also there are some diseases, pre-existing diseases, or some diseases, say patients suffering from fever, high fever, malaria, typhoid, kala-jor, or dengue fever. Sometimes with varicella, there may be diffuse hair loss immediately after the fever, or sometimes with some medicines, some antibiotics, some anti-malarial. These are also some causes of acute telogen effluvium. There is another condition, or chronic telogen effluvium, in which there may be some underlying metabolic diseases like hypothyroidism or hyperthyroidism. Also, in our clinical practices, we come across so many cases with sometimes some idiopathic diffuse hair loss. On investigations, when you come across this type of patient, definitely we have to investigate the patients, and we have seen so many cases. Apart from thyroid disorder, there is a problem with the iron. If the serum ferritin level is low, then definitely that might be another cause of diffuse hair loss. So whenever you come across a patient of diffuse hair loss, you have to think of these underlying diseases as well as some medication. So in case of anagen effluvium, again there is another most vital cause of hair loss. Sometimes in some patients with chemotherapeutic agents, patient has been suffering from malignancy, and whenever treated with chemotherapy, so there is sudden loss of hair. So immediately after 3 weeks or 4 weeks, the patient, there is loss of hair and there is visible hair loss in the scalp. So these are few most common, I should say, most common cause of hair loss, apart from infection, apart from metabolic causes, and some other deficiency diseases. So whenever you come across these type of patients, we have seen particularly in the menopausal age group, so many patients have been suffering from this type of problem. We have seen so many cases in the younger age group, particularly in case of female. So they are much more concerned about the hair loss, and definitely you have to investigate and you have to treat. But you should not forget about the androgenetic alopecia. So this is another one of the most common cause at this moment of androgenetic alopecia, both in female as well as in male. Of course, the incidence in case of male is little high. So whenever there is history of hair loss, there is androgenetic alopecia in case of say family history of androgenetic alopecia, then definitely you should think of androgenetic alopecia. In case of female, there is a loss of hair in the central part, there is widening of the central parting of the hair, and in case of male, there is recession, temporal recession, as well as the vertex area. So this is another hormonal causes. So whenever we come across diffuse alopecia, whenever we come across hair loss, we should think about telogen effluvium. We should think about sometimes chronic or acute telogen effluvium, sometimes anagen effluvium and diffuse hair loss, and sometimes with androgenetic alopecia. So these are some few causes and pattern and presentation of alopecia. So whenever you come across this group of patients, after a proper investigation, starting from routine biochemical test, sugar, thyroid, serum ferritin, also sometimes other hormonal assessment, dihydroepiandrosterone should be tested if you consider a case of androgenetic alopecia. then according to cause you have to manage, you have to treat the patient. So in case of chronic acute telogen effluvium, so you have to find out if it is underlying cause like dengue fever or malaria or typhoid or varicella. Reassurance is very important. You should supplement biotin supplementation, and sometimes you have to give other medication like other minerals. Sometimes zinc is also helpful. In case of anogenic effluvium, definitely obviously a chemotherapeutic agent, the withdraw the medicines and immediately gradually the hair will regain again. Reassurance is very important. Sometimes psychological stress, mental stress, physical stress is another factor. We are not able to find out the obvious cause in some cases. In those cases, the mental and physical or psychological stress is another factor. So this is how you have to reassure the patient that you have a certain loss of hair, and you must remember daily 50 to 100 number of hair loss is usually normal. So usually this number of hair growth is usually there, but whenever there is cause, you have to treat the cause, and finally you have to go for the specific medicine. Among the specific medicine, so whenever the patient suffering from say seborrheic cavities, then definitely you have to treat it. You have to treat with ketoconazole ZPTO shampoo. Sometimes you have to treat with ketoconazole with salicylic acid. If very stubborn infections or seborrhea is there, then always advise your patient, counsel your patient to rinse properly. So washing should be every alternate days is ideally we advise, and rinsing of the hair is one of the most important. Improper rinsing again will precipitate the cause. Then other medications, as I have already mentioned, biotin, zinc are essential for hair growth, and in case of androgenetic alopecia, the best drug of choice is topical minoxidil. In case of male, the topical minoxidil should be 5%, and you should always advise them to apply twice daily. The foam preparation sometimes preferred if the patient is sensitive to propylene glycol based minoxidil, because foam is free from propylene glycol, and you always advise them to continue it for a long time. In case of female, also nowadays we have seen in a middle-aged age group, 5% once daily minoxidil is much more effective than 2% minoxidil, and it is quite effective, but you have to counsel your patient to continue the treatment for a long time, because adherence to the treatment is very important. In case of male, finasteride 1 milligram is quite effective, and definitely after investigation we can start finasteride along with biotin. So dose of finasteride in male is 1 milligram, and it is quite effective. In case of female, in the postmenopausal age group, we can prescribe finasteride in little higher dose, 2.5 milligram is quite effective. But remember, finasteride should not be given in the child-bearing age group, it is teratogenic. So this is how you can manage a case of diffuse alopecia, and definitely your reassurance, your counseling part is very important. It is very important to find out the cause, and according to cause, if you treat it, and reassurance for the adherence to the treatment is very important. Androgenetic alopecia needs long treatment, and the combination therapy is important. Nowadays, different types of modalities of treatment like PRP has been tried with great success, but with PRP also finasteride should be added, and mesotherapy is also another treatment, another choice of treatment. Certain cases of androgenetic alopecia hair transplantation is also advisable in some cases, and this is how you can manage a case of diffuse alopecia. Thank you.